Good day everyone, my name is Mary Rose Embalingit from Nueva Ecija University of Science and Technology under BSN 3G. So for today, I will be demonstrate for nasogastric tube feeding, and for the assessment, we need to assess the doctor's order, the client's level of consciousness and level of knowledge and understanding, the availability and functionality of the needed materials, for any clinical signs of malnutrition or dehydration, for allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula, notify the primary care provider if any incompatibilities exist. For the planning, before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feedings. Prepare equipment, correct type and amount of feeding solution, 60 ml catheter tip syringe, MSS basin, clean gloves, pH test strip or meter, large urine or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or filled bladder without drip chamber, tubing, and a flow regulator clamp. Measuring container from which to pour the feeding if using open system. Water, 60 ml unless otherwise specified at room temperature. Feeding pump as required. For the implementation procedure, prior to performing the feeding, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do, why is it necessary, and how he or she can participate. Inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness.
And it will not cause you a discomfort, but it may cause you a feeling of fullness.
Perform hand hygiene and observe other appropriate infection control procedure. Provide privacy for this procedure if the client desires it. Tube feedings are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature. Rationale: an excessively cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all the water is instilled. Rationale: clamping prevents air from entering the tube. Ensure client comfort and safety. Secure the tubing to the client's gown. Rationale: this minimizes pulling the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. Rationale: these positions facilitate digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. Evaluation: evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart.